Every time you read a headline about opioid overdoses or see a chart mapping infant mortality, it feels like that data is instantaneously available. We expect massive national public health data sets to be just a few keystrokes away. But nearly all of those journalists, researchers, and policymakers are pulling from the exact same source. It's a tool called CDC WONDER, the wide-ranging online data for epidemiological research. It is a massive database built in the 1990s that serves as the backbone of American epidemiology. Before WONDER, tracking a disease required moving physical objects. The nation's ability to monitor health crises was tightly constrained by the physical limits of paper. In the 1980s, public health intelligence was fragmented. Vital data was locked inside hospital registries, filed in state offices, and stored in isolated computer systems. To gather national data, state health departments literally mailed physical tapes and floppy disks back and forth to the federal government. Researchers had to wait weeks for these packages to arrive. Once they did, epidemiologists spent hundreds of hours manually merging incompatible file formats and resolving inconsistent medical coding line by line. When the foundational data moves at the speed of the Postal Service, the public health response moves exactly as slowly. It makes tracking a fast-moving epidemic nearly impossible. To solve this, the CDC built a classic 1990s federal data warehouse, running on beige, boxy hardware designed purely for reliability. This diagram illustrates their central technical strategy, a hybrid architecture. WONDER splits the labor, using a software suite called SAS to handle the heavy statistical lifting, and an Oracle database system to provide durable, long-term storage. The process starts at the ingest phase. Millions of local records, individual death certificates containing specific demographic and medical details, are fed into the top of the pipeline. Next is the extract, transform, and load phase. SAS standardizes the varying causes of death into uniform ICD codes. Finally, these uniform records are deposited into Oracle tables, optimized for massive group-by queries to summarize millions of rows in seconds. This pipeline took decades of isolated analog tragedies and converted them into a highly structured engine of digital intelligence. Today, an epidemiologist simply opens a web browser, selects their filters, and submits a query. But the system immediately confronts a core engineering paradox. It must provide total statistical transparency to the public, while mechanically guaranteeing that zero individuals can be identified from the results. This map illustrates how the privacy engine enforces that rule. WONDER applies minimum thresholds. If a query targets a small bounty or a rare cause of death, the system suppresses those sparse points to prevent re-identification. Once cleared, SAS performs age adjustments and outputs aggregated results. This strict mathematical balance, delivering transparency without exposure, is the structural reason WONDER has survived for 3 decades without a major privacy breach. To understand the external impact of this architecture, you only have to look at the opioid epidemic. Researchers utilized WONDER to map the crisis. Querying the data, they detected early overdose hotspots and tracked the geographic spread of fentanyl. These charts reveal stark differences between rural and urban mortality trajectories, directing where state and federal interventions were deployed. Without a unified, searchable data warehouse, a crisis of this magnitude would have been effectively invisible until the death toll was too massive to ignore. WONDER now stores every single death certificate issued in the United States since 1968. It tracks cancer incidents, birth rates, environmental exposures, and chronic disease indicators. It has evolved from rigid CGI scripts running on beige servers in the 90s to a unified cloud platform queried millions of times a year. CDC WONDER remains the ultimate democratized database. It is a highly functional industrial engine that takes the raw data of mortality and translates it into the intelligence required to protect public health.